One of the nandun sa list is mental health issues like depression and anxiety. So in adolescent medicine, it's a subspecialty of pediatrics that encompasses all the problems of adolescents. Suicide, the third leading cause of death among adolescents.
So number 1, sabi nga ni Doktora, depression. So number 2,
We have body image issues. Body image.
Anong mga issues nila regarding body image?
Kasi di ba ito yung period kung saan merong mga pagbabago sa katawan, no? So hindi nila maintindihan.
Hi guys, this is me, Dr. Johan, known as Dr. Y. So welcome again to our next episode in Dr. Y Skin Talks. I think pang 5th episode ko na to. So guys, change outfit tayo, di ba? So you know what? Yung last natin na guest was actually Miss Coke. But right now, we'll be more professional naman. Related naman sa field of medicine. So as you all know, kahit ako, hindi ko rin alam na meron na palang ganitong specialty. Guys, remember? So you know how diverse medicine is already. So marami na tayong mga subspecialties that are coming along the way. But itong special nito is very timely nowadays, especially our young teens. So ito yung mga adolescents natin. So we will be talking more about adolescent medicine. So here in Region 8, nako, nag-iisa lang ito siya. So I am proud na i-invite siya dito sa Dr. Y Skin Talks, tackling on different issues related to adolescence. So I would like to welcome Dr. Rajami Malibago. Wow!
Hey!
Hey, Rajami! Welcome to Dr. Y Skin Talks. Oo.
I'm happy to
So,
be
diba,
here.
yes. So, si Rajami, syempre siya lang ang, I think, nag-iisang adolescent medicine specialist, especially here in Region 8. So, mag-uusap kami related to adolescence. O, di ba? Pinagdaanan naman natin maging adolescent.
Oh, yes.
Oo. So, marami tayong mga changes noon. So, ito yung sinasabi nating nagdadala ka,
Yes.
nagbibinata, oo, nagkakaroon ng mga crush, di ba? Pero ako nung adolescence, ang experience ko, pimple. Wow!
Oh, yes.
Mga
So, lahat naman
issues,
tayo
mga
nagdudugo
acne.
ata.
Parang 11 years old pa lang ako. Acne. Tapos yung irregular menstrual
Menstruation.
period. Oo, menstruation. Yun. Pero marami din akong memories ng bata ko kasi I enjoyed my childhood years. So now, very timely talaga yung pagiging guest mo here because we will be tackling pala na yung mga different adolescent issues during the present times na. Itong mga present. Siyempre, iba yung mga time natin.
Oh, yes, different.
Oo, iba yung mga
Totally
issues
different.
natin, di ba?
Yes.
Oo, ngayon, iba naman. Oo. So, let's sit down and let's
Okay.
start the ball rolling.
Perfect.
So now, my first question is, so Rajami, can you tell me something about yourself?
Okay.
Siyempre, how did you go about into adolescent medicine as subspecialty in medicine? Oo.
So I am Dr. Malibago. You can call me
Yes.
Jam. So I am a pure Taclobanon.
Oo.
Okay, I graduated medicine here in RTR
Yes.
and had residency training in Manila and then
Oo.
fellowship training in PGH.
So ang residency training mo was in pediatrics or?
Sorry, in pediatrics.
Pediatrics.
East Avenue Medical Center.
Wow! Pareho
Kasi,
tayo! Kasi! Oh my
same
God!
institution.
Ang daming pasyente.
Ay, sobra. It's
Oo.
like EBMC.
Ayoko na lang. Hindi
Parang
pwedeng
ADMC.
makakomment sa ganon. Oo. And then, your adolescent medicine.
Training in UPPGH.
UPPGH. So guys, oo, meron na palang adolescent medicine training. I think, yun nga, in UPPGH. And you said,
In Philippine Children Medical Center.
yan, oo. So now, I'll be asking, ano ba talaga yung adolescent medicine? But before I start, ano nga ba yung, what is naman adolescence? Kasi dapat nila malaman kung anong age group ang adolescence, di ba? Kasi may phases in life eh. Meron tayong childhood, may infants, toddler, young children, and then pumapasok yung mga adolescents. Pero ang tanong ko, anong age group siya? Oo.
Okay, so yung adolescence, isa siyang biopsychosocial process that begins before the changes that we encounter during puberty, yung mga pagkakaroon ng pimples, pagkakaroon ng
breast
changes sa breast, at sa mga lalaki naman yung mga changes sa voice. So even before those changes, and then after the termination of growth, sa physical yon. Pero it involves different changes din sa emotional, psychosocial, cognitive, so madaming changes that occurs.
So parang sa bata, meron tayo yung changes ng growth, yung cognitive, di ba? Social development. So ganun din sa adolescence.
Ganun sa adolescence.
Except anong age group to sila?
So yung age group ay between 10 to 19 years old.
10 to 19.
Yes. 10 to 19. So the teen years.
Teen years talaga. So how do we categorize itong age group na to ng adolescence? Parang naalala ko sa pedia, meron tayong young, mid, and late. Yun lang yung naalala ko.
So thank you for mentioning this, no? Kasi we have 3 phases. We have first, early adolescence, yung 10 to 13, and we have middle, 14 to 16, and we have late, yung 17 to 19.
My guys, naalala ko pa yung developmental milestones. Mahirap.
Memorize.
Yes, kasama yan sa exam. Nahirapan ako mag-memorize.
Kailan nag-start mag-save ba?
Yes, Pero yung mga early adolescents, ang na-remember ko is that they usually have yung attraction of the same sex. Tapos they are more physically about themselves yun. Nag-start na sila ng mga changes na parang nagiging conscious about themselves. Yung naalala ko rin sa middle is attraction with the opposite sex. So yun, nagkakaroon sila ng crushes, yung mga ganon, and they go into mga relationships as well. Ang naalala ko naman sa late, yung mas goal-oriented na sila kasi nasa college life na eh. Diba yung parang mga goals nila kung paano sila after college, yung mga ganyan.
Is it okay if I add?
Yes.
So generally, merong mga tasks yung adolescence, no? It goes for all age groups, early, middle, and late. Yung first is they have expanding cognitive development. So each phase, iba-iba yon. So kung early, sabi mo nga, it's not yet fully mature. Middle, they're able to comprehend, pero not so pa. And then late, nakaka-understand na or make abstract reasoning, but not so yet, no? Kasi nagmamature yung pag 25 years old. So one is the expanding cognitive development, yung brain development. The second is achieving body image, no? So they have body image issues. So it goes for all phases then. Third is a dependence from parents. So isa sa mga milestones talaga nila is to be independent from their parents. That's why yung next is they want to be with their peers or with their friends. No, they will adapt to the roles of their friends and then to the lifestyles of their friends. No, and then last yung ability to understand who they are. So ito yung nagtatanong sila, sino ba ako? Who am I? To their identity. So their role, their purpose in life, no? So each phase, iba-iba yon.
So dito yung pumapasok yung identity crisis.
Yes. Identity formation versus role confusion. Yung kay Eric Erickson, ate yun yung so dito yun.
So kaya pala hindi ako nag-pedya. Kasi hindi ko hindi ko naiintindihan. Okay. So ngayon, we were able to define adolescence. So ano naman ngayon yung specialty na adolescent and young adult medicine?
Okay.
So ano naman ang mga roles nyo? Oo.
So in adolescent medicine, it's a subspecialty of pediatrics that encompasses all the problems of adolescence. So lahat yung physical, mental, so yung medical conditions. Pero do know that this period, yung adolescence, is a period which is the healthiest. Actually, healthiest. You don't usually go to the clinic because of problems sa heart, no,
yes.
or sa tiyan. But the usual concerns, yung psychosocial, no? So yung meron silang problems sa school, mental health issues, problem with sleep, or sometimes meron ding physical manifestations ng anxiety like chest pain, merong ganyan.
So yan pala yung mga nakikita
yes,
natin. So being an adolescent medicine, you have to have a medical degree. Okay? Importante kasi yon. Kasi baka ang isipin lang nila, yung mga adolescent medicine doctors, they don't have medical degree. So they are also, they have medical degree talaga. Okay?
And pediatrician.
And they are also pediatrician. So isang subspecialty ito under pediatrics. So yon. Okay. So next, ano naman ang mga nagiging functions ninyo?
If they have medical conditions, then we treat them accordingly, no?
Okay.
Pero we partner with other subspecialty. For example, kung meron silang chronic illness, halimbawa may rheumatic heart disease, ganyan.
Yes.
So kung yung concern ay paano maging compliant to the medications, then they refer to us, no? So we partner with them, even with other chronic illness, halimbawa sa pulmo, halimbawa sa rheuma.
Paano kayo pumapasok doon? Kasi 'di ba, for example, like what you said, rheumatologist. So how do you guide? Parang you guide the adolescents.
Yes, we guide the adolescent. Those na the other critical management ng illness nila na hindi usually na-address din minsan, hindi lang pharmacologic to non-pharmacologic compliance to medications. How will they transition kapag nandus na sila sa adult sa adult care. So parang kasama kami sa team of doctors who will help the teenager navigate sa kanilang illness.
Okay, kasi syempre emotionally, sabi mo,
so we have to
cognitive,
screen them.
behaviorally, hindi pa naman sila fully developed because parang nagda-navigate pa nga sila along this world. So parents, listen tayo ha, kasi like ako, parent din ako. So alam mo, yung usapan natin, medyo mas nagiging malalim na. So like that, yung nakikita natin na kailangan pala yung specialty ng adolescent medicine pumasok, especially yung mga bata or adolescents who have major illnesses that need to be on medications. So yung compliance is very important. So minsan, bilang parent, wag natin iba-brush off lang yon. Wag natin binabaliwala o dinidismiss yung mga signs and symptoms na nakikita natin sa mga anak. So let's dig deeper more. So next, I would like to ask, what are the common issues of the adolescents nowadays? Kahit mga around 5 lang.
Okay. Kasi mahaba yung list, no? One of the nandun sa list is mental health issues like depression and anxiety. We should know that, sabi ko nga kanina, healthiest period sila. Pero one of the reasons for consult and actually for mortality, merong ibang namamatay dahil sa preventable na mga diseases. Yung isa ay suicide, no? Suicide, the third leading cause of death among adolescents.
May I ask, ano yung mga nagiging symptoms nila? Bakit they resort into those depression?
Actually walang one walang factor, walang number one. Actually sa multifaceted siya, madami, no? So pwede sa family, we have friends, we have academics, no? Body image. So madami talagang factors that we have to consider.
And then siguro mga peers din, like sa school, kung nabubuli. I think nakaka-contribute din kasi yon. So, number 1, sabi nga ni Doktora, depression. So, number 2,
we have body image issues. Body image.
Anong mga issues nila regarding body image? age.
Kasi di ba ito yung period kung saan merong mga pagbabago sa katawan, no? So hindi nila maintindihan. Also
Yes.
because of the hormones, raging hormones. That's
classic
going
example
on.
yung mga acne.
Tama, o yung pimples. You don't understand.
Kaya pala, oo. Actually, I've also undergone din kasi at a young age, I had acne. But siguro those times wherein there were no television and everything. So medyo hindi pa tayo conscious.
Yes.
So sorry guys, 1994 ako nag-first year high school. I had acne. But siguro dito kasi sa provinces, they would always tell, normal lang yan. But I'd like to add that it was my mother who really brought me to the dermatologist so that I won't develop yung tinatawag natin na low self-esteem. So parang mahihiyain, maging shy. Pero ngayon kasi, as a dermatologist, I noticed marami na ring mga bata na having acne and they don't want to go to school kasi nga nahihiya sila dahil maraming tagyawat. So part din as a dermatologist, I do also, para na rin akong nagka-counseling. I would always tell na dapat hindi yon mag-engage na hindi ka pumasok because you have acne. Anyway, this kind of diseases in the skin are treatable naman. Oo. As long as yun nga, you adhere to compliance with application of the medication. Oo nga, totoo. Parang yung iba may mga suicidal ideations.
I would like to cite an example. So, meron akong 13-year-old female na meron siyang pimple. Hindi naman sobrang dami na buong mukha, pero meron siyang isa lang. Pero it was for her, it was the biggest problem sa kanya and it caused her to ingest many medications. So, nadala siya sa emergency room dahil doon. No, so kung titingnan natin kung from our point, sabihin natin bakit naman ang liit lang naman yan na problema compared sa problema natin, no? Pero all these issues we have to acknowledge kasi sabi nga 'di ba, ito yung isa sa mga concern being them adolescents na hindi pa ganoon develop yung brain nila, no? So those issues we have to acknowledge, we have to listen, and we have to address, no? That don't simply brush it off, sabi niyo nga, yung mga
so I guess
concerns nila.
Parenting skills are different now.
Yes,
unlike before.
Kasi na-amplify nga because of the social media. At a young age, meron na silang phone. They have access to all this social media sites na iba yung nila ng beauty ng standards.
So kasi ang alam lang namin, beautiful lang kami. Wala naman kaming comparison na iba dito. So number 3 na ba?
Number 3, yung risk-taking behavior na isa, yung smoking. That includes vaping. That's very common
alcohol
nowadays.
Abuse.
Yeah, alcohol use, illicit drug use. Yun.
So mas nagiging rampant na nowadays kasi easy access din. Imagine mo online, pwede ka na makabili ng drugs. Minsan nga nasa doorstep mo na makakabili ka na agad.
And they come in many forms. Basta madami na innovative na way para i-encourage sila to have this.
So dapat iwas-iwasan natin. So that's number 4. Number 5.
We have sexually transmitted diseases na quite alarming. Like sa atin, yung Region 8, isa na tayo doon sa top 5, no? Sa Philippines. Sa leading with high numbers of HIV cases and then common among teenagers until and young adults.
Kasi nakikita namin, like ako, pinaka-youngest ko na HIV, yan, mga around mga college years din yung mga risky behaviors. Yun. I think we have to add up also teenage pregnancy.
Oh yes, teenage pregnancy.
That's also very high here in
Region 8. Kasama din tayo sa top 5 doon.
Okay. So, yon. So, guys, we have to move forward kasi diba, kagaya niyan, mataas yung teenage pregnancy, yung mga illicit drug use, and those having sexually transmitted infections. So, wag tayong mag-lose hope. There is help. So, usually, who do you partner with? For example, kasi mahirap naman kung ikaw lahat. Imagine mo, ang laki-laki ng population ng Region 8. But I guess meron ka ring mga partner centers that you are in collaboration with to help these mga adolescents. Oo.
Okay, so I partner with, like ako, Women and Child Protection Unit for those abuse. I also partner with OB, no? For example, those adolescents, so teen moms who have concerns about their education, ano yung mangyayari after. Actually, if we screen them also for depression, may kita mo merong iba that they have. No, there are also those group of population na merong high risk for depression, especially if may component ng abuse, no? For those na
yun yung Women Protection Desk.
Women and Child Protection Unit.
Unit of the PNP.
Eastern Visayas Medical Center.
Okay. So aside from that, parang ano din sa mga DSWD, syempre kasi nandun din yung mga batang mga abuse sa mga social workers.
So they refer those patients to me.
So now, Rajami, ang mga questions natin kasi sa medicine, di ba merong sinasabing pivot. So ang pivot namin kasi very timely ngayon is related to social media. So medyo dito naka-center yung mga questions that addresses yung mga problems ng mga adolescents. Kasi yun ang ano ngayon nandun tayo sa peak ng technology, which is actually social media. Kahit nga tayo, napapa-social media. To be able to say our, how do you call this, yung mga advocacies natin as a doctor to be able to help a lot of patients in terms of their medical and non-medical concerns. Pero syempre, wag lang sa pera. Wala tayo niyan. Ang may bibigay natin yung mga professional advice natin. Okay.
You have to have a non-judgmental attitude. So you have to first, so dapat wala kang bias.
Para lang for everyone to know. Kasi para din yung you have a psychiatric evaluation. So you also have your own head's evaluation.
Yes. Pero you have to mention the confidentiality clause and its limits with the companion around, with the parent around initially para alam ng mother, bakit kailangan ako lumabas? And
so for me, you advise na mas maganda yung mga young adolescents na huwag munang mag-cellphone, no?